What if constant tiredness, frequent infections, or easy bruising were not just stress or low immunity, but an early warning sign of a blood cancer? Today, we are talking about leukemia, what it is, the different types, how doctors diagnose it, and how it is treated. And here's the good news. Many forms of leukemia are treatable, and some can be controlled for years with modern therapy. Hello everyone, I'm Dr. PK. In this video, I will explain leukemia in simple language. We will cover what leukemia is, the main types, common symptoms, how diagnosis is made, and the modern treatment options available today. So stay with me because understanding leukemia early can truly save lives. Leukemia is a cancer of the blood-forming tissues, mainly the bone marrow, where blood cells are made. In leukemia, abnormal white blood cells grow out of control. These abnormal cells crowd out normal blood-making cells, so the body may not produce enough healthy red blood cells, platelets, or working white blood cells. That is why symptoms develop. Think of the bone marrow like a factory. A healthy factory makes balanced blood cells. A leukemia factory starts producing too many abnormal cells. Leukemia is usually divided in two ways. First, acute versus chronic. Acute leukemia grows fast and needs urgent treatment. Chronic leukemia grows slowly and may be found on routine blood work. Second, lymphoid versus myeloid. This refers to which blood cell line has turned cancerous. That gives us the four major types. The first type is acute lymphoblastic leukemia, or ALL. This is fast-growing and more common in children, though adults can get it too. Treatment often includes chemotherapy, targeted therapy, immunotherapy, and sometimes stem cell transplant. The second type is acute myeloid leukemia, or AML. This is also fast-growing, but starts in myeloid cells. It is more common in adults. AML can cause symptoms quickly and often requires prompt medical evaluation and treatment. The third type is chronic lymphocytic leukemia, or CLL. This usually affects older adults and often develops very slowly. Some people have no symptoms at first and may not need treatment right away. In selected cases, doctors simply monitor the disease. The fourth type is chronic myeloid leukemia, or CML. This is a chronic leukemia often found incidentally on a routine blood test. Many patients today do very well because of targeted medicines that block the abnormal signal driving the disease. Now here is something very important. The symptoms of leukemia can be vague in the beginning. Common symptoms include persistent fatigue or weakness, shortness of breath, and frequent infections. You may also experience fevers, night sweats, unexplained weight loss, or easy bruising and bleeding. Other signs include bone or joint pain, enlarged lymph nodes, and abdominal fullness from an enlarged spleen. Why do these happen? Because leukemia lowers normal blood counts, low red cells cause anemia, low platelets cause bleeding. Not every tired person has leukemia, but persistent unexplained fatigue with bruising should never be ignored. So how do doctors diagnose it? It often starts with a CBC, which may show very high or very low white blood cells. A doctor may also look at a blood smear under the microscope to see if abnormal blast cells are present. The key test is a bone marrow biopsy, where a sample is taken from the hip bone to confirm the exact subtype. Advanced tests like cytogenetics and molecular testing identify gene changes that guide our treatment decisions. Treatment depends on the type of leukemia, the patient's age, and the specific genetic features of the disease. For acute leukemias, treatment starts quickly. The first goal is remission, followed by treatment to prevent relapse. This may include chemotherapy, targeted therapy, immunotherapy, and in some cases, a stem cell transplant. For chronic leukemias, some patients just need watchful waiting. Others do extremely well on daily targeted pills. Supportive care is also vital. This includes blood transfusions and antibiotics to keep the patient safe through therapy. Hearing the word leukemia is frightening, but outcomes today are much better due to incredible medical advances. Better supportive care and targeted therapies mean many patients now live long, full lives after diagnosis. Please see a doctor for unexplained fatigue, repeated infections, or unusual bruising. Do not panic, but do not ignore it. Early awareness makes a real difference. If this helped, please share it. I'm Dr. PK. Stay informed, stay healthy.